Part 5. Points 3. Points of the spleen meridian of foot tie-in. There are 21 points on the spleen meridian of one side. They are located in the anteromedial side of the lower extremities and the lateral sides of the chest and abdomen. The first point is Yin Bai, spleen 1. And the last point is Da Bao, spleen 21. Among them, 7 commonly used points are selected and introduced here. Yin Bai, spleen 1. On the medial side of the great toe, point 1 Cun posterior to the corner of the nail. It's the Jing Well point spleen meridian. Indications: abdominal distension, unconsciousness, menorrhagia, uterine bleeding, and dreamed disturbed sleep. Puncture point 1 to point 2 Cun and use 2 to 3 cones Moxibustion for 5 to 10 minutes. Tai Bai, spleen 3. On the medial margin of the foot, in the depression of the junction of the red and white skin, proximal and inferior to the first metatarsodigital joint. It's the shoestring and yuan primary point of the spleen meridian. Indications: gastric pain and abdominal distension. Puncture point 3 to point 5 Cun and apply 3 to 5 moxa cones or 5 to 10 minutes Moxibustion. Gong Cun, spleen 4. On the medial margin of the foot, in the depression distal and inferior to the base of the first metatarsal bone. It's the lower connecting point of the spleen meridian and one of the 8 confluent points. Indications: gastric pain, vomiting, abdominal distension and pain, dysentery, feverish sensation in the soles, and insomnia. Puncture 0.5 to 1 Cun or apply 3 to 5 moxa cones or 10 to 20 minutes Moxibustion. Sanjiao, spleen 6. On the medial side of the leg, 3 Cun above the medial malleolus, in the depression posterior to the medial border of the tibia. Indications: abdominal pain and distension, diarrhea, dysmenorrhea, irregular menstruation, uterine bleeding, leukorrhea, sterility, impotence, nocturnal emission, enuresis, dysuria, edema, headache, vertigo, insomnia, muscular atrophy and motor impairment of the lower extremities, palpitation, epigastric pain, gastritosis, hemorrhoids, obesity, and to aid stopping smoking. Puncture 0.5 to 1 Cun, apply 3 to 5 moxa cones or 5 to 10 minutes Moxibustion. Acupuncture is not applicable for pregnant women. DG, spleen 8. On the medial side of the leg, on the line connecting the tip of the medial malleolus and Yinling Quan, spleen 9 Cun above the medial malleolus or 3 Cun below Yinling Quan, spleen 9. It's the C cleft point of the spleen meridian. Indications: abdominal pain and distension, nocturnal emission, irregular menstruation, dysmenorrhea, Wei syndromes, and appendicitis. Puncture 0.5 to 1 Cun, apply 3 to 5 moxa cones or 10 to 20 minutes Moxibustion. Yinling Quan, spleen 9. On the medial side of the leg, in the depression posterior and inferior to the medial condyle of the tibia. It's the He Xue C point of the spleen meridian. Indications: abdominal pain and distension, diarrhea, dysentery, edema, jaundice, dysuria, enuresis, incontinence of the urine, pain of the external genitalia, dysmenorrhea, swelling and pain of the leg and knee, B syndromes, Wei syndromes, sterility, impotence, and rubella. It is also used in cosmetology. Puncture 0.3 to 0.5 Cun and apply 3 to 5 moxa cones or 10 to 20 minutes Moxibustion. Xue Hai, spleen 10. With the knee flexed on the medial side of the thigh, 2 Cun above the medial superior border of the patella, on the bulge of the medial portion of muscle quadriceps femoris. Indications: irregular menstruation, dysmenorrhea, pain in the medial side of the thigh, and appendicitis. It is also used in cosmetology. Puncture 0.5 to 0.8 cun, apply 3 to 5 moxicones, or 10 to 20 minutes moxibustion. Points of the kidney meridian of foot Shaoyin. There are 27 points on the kidney meridian of one side. They are located in the posterior medial side of the lower extremities and both sides of the Ren meridian on the chest and abdomen. The first point is Yongquan, kidney 1. And the last one is Shufu, kidney 27. Among them, 6 commonly used points are selected and introduced here. Yongquan, kidney 1. On the anterior part of the sole, in the depression at the junction of the anterior third and posterior 2/3 of the sole, between the second and third metatarsal bones, is the Jingwell point of the kidney meridian. Indications: sunstroke, syncope, hysteria, epilepsy, headache, blurred vision, sore throat, and feverish sensation in the soles. Puncture 0.3 to 0.5 cun, apply 3 to 5 moxicones, or 10 to 20 minutes moxibustion. Guangu, kidney 2. On the medial margin of the foot, at the junction of the red and white skin, inferior to the tuberosity of the navicular bone. It's the yin spring point of the kidney meridian. Indications: sore throat, spontaneous sweating, night sweating, diabetes, itching of the external genitalia, irregular menstruation, and nocturnal emission. Puncture 0.3 to 0.5 cun, apply 3 to 5 moxicones, or 10 to 20 minutes moxibustion. Taixi, kidney 3. Posterior to the medial malleolus, in the depression between the tip of the medial malleolus and tendon calcaneus. It's the shoestring point and yuan primary point of the kidney meridian. Indications: sore throat, toothache, deafness, tinnitus, dizziness, asthma, diabetes, irregular menstruation, insomnia, nocturnal emission, impotence, frequent urination, pain of the lumbar vertebrae, paralysis of the lower limbs, and sterility. Puncture 0.3 to 0.5 cun, apply 3 to 5 moxicones, or 10 to 20 minutes moxibustion. Jiaohai, kidney 6. In the depression inferior to the medial malleolus, one of the 8 confluent points. Indications: sore throat, asthma, epilepsy, irregular menstruation, leukorrhea, itching of the external genitalia, prolapse of uterus, retention of urine, frequent urination, constipation, insomnia, and hysteria. It is also used in cosmetology. Puncture 0.3 to 0.5 cun, apply 3 to 5 moxicones, or 10 to 20 minutes moxibustion. Fuliu, kidney 7. On the medial side of the leg, 2 cun directly above Taixi, kidney 3, anterior to the tendon calcaneus. It's the Jing River point of the kidney meridian. Indications: edema, abdominal distension, diarrhea, night sweating, spontaneous sweating, infantile paralysis. Puncture 0.3 to 0.5 cun, apply 3 to 5 moxicones, or 10 to 20 minutes moxibustion. Ingu, kidney 10. On the medial side of the popliteal fossa, with the knee flexed between the tendons of muscle semitendinosus and semimembranosus. It's the He point of the kidney meridian. Indications are dampness and itching of the external genitalia. Puncture 0.3 to 0.6 Cun. Apply 3 to 5 moxicons or 10 to 20 minutes moxibustion. Points of the liver meridian of foot Jueyin. There are 28 points on the liver meridian, 14 points on each side, which are located on the medial aspect of the medial side of the lower limbs, abdominal and chest regions. The first point is Dazun, liver 1. The last point is Qimen, liver 14. 7 commonly used points are selected and introduced here. Dazun, liver 1. On the lateral side of the dorsum of the terminal phalanx of the great toe, 0.1 Cun lateral to the corner of the nail. It's the Jingwell point of the liver meridian. Indications: hernia, enuresis, uterine bleeding, after-wind stroke. Puncture 0.1 Cun, apply 3 to 5 moxicons or 5 to 10 minutes moxibustion. Xingjian, liver 2. On the dorsum of the foot between the first and second toe, in the red and white skin, proximal to the margin of the web. It's the yin spring point of the liver meridian. Indications: headache, dizziness, insomnia, hypochondriac pain, abdominal distension, hernia, impaired urination, pain in the penis, epilepsy, and hysteria. Puncture 0.2 to 0.3 Cun, apply 3 to 5 moxicons or 5 to 10 minutes moxibustion. Taichung, liver 3. On the dorsum of the foot, in the depression distal to the junction of the first and second metatarsal bones. It's the shu stream and yuan source point of the liver meridian. Indications: headache, dizziness, insomnia, pain and swelling of the eyes, infantile convulsion, epilepsy, functional uterine bleeding, hernia, constipation, sterility, hysteria, diabetes, mumps, tinnitus, and deafness. Puncture 0.3 to 0.5 Cun, apply 3 to 5 moxicons or 5 to 10 minutes moxibustion. Ligou, liver 5. On the medial side of the leg, 5 Cun above the tip of the medial malleolus, in the depression posterior to the medial border of the tibia. It's the lower connecting point of the liver meridian. Indications: hernia, testitis, distending pain of the lower abdomen, dysuria, enuresis, irregular menstruation, leukorrhea. Puncture 0.3 to 0.5 Cun, apply 3 to 5 moxicons or 10 to 20 minutes moxibustion. Ququan, liver 8. Posterior to the medial epicondyle of the femur, in the depression on the anterior part of the insertion of semimembranosus and muscle semitendinosus. It's the He point of the liver meridian. Indications: lower abdominal pain, pain in the external genitalia, and pain in the medial aspect of the knee and thigh. Puncture 0.5 to 0.8 Cun, apply 3 to 5 moxicons or 10 to 20 minutes moxibustion. Zhangmen, liver 13. On the lateral side of the abdomen, below the free end of the 11th floating rib. It's the influential point of the Zang organs. Indications: pain in the hypochondriac region, abdominal distension, stomachache, and diarrhea. Puncture 0.5 to 0.8 Cun, apply 3 to 5 moxicons or 10 to 20 minutes moxibustion. Qimen, liver 14. On the lower part of the chest, directly below the nipple in the 6th intercostal space. It's the front mu point of the liver. Indications: hypochondriac pain, abdominal distension, intercostal neuralgia, hepatitis, cholecystitis, mastitis. Puncture 0.2 to 0.3 Cun, apply 3 to 5 moxicons, or 10 to 20 minutes moxibustion. 经外学 extra points. Yin Tang, extra point. On the forehead, midway between the medial ends of the 2 eyebrows. Indications: headache, dizziness, eye and nose diseases, insomnia, and hysteria. It is also used in cosmetology. Puncture 0.3 to 0.5 Cun, apply 3 to 5 moxicons, or 5 to 10 minutes moxibustion. Qiu Hou, extra point. On the face, at the junction of the lateral 1/4 and medial 3/4. Indications: eye diseases such as optic inflammation and teenage myopia. Puncture 0.5 to 1.2 Cun and apply mild stimulation. Taiyang, extra point. On the temple region, in the depression about 1 Cun posterior to the midpoint between the lateral end of the eyebrow and the outer canthus. Indications: headache, dizziness, redness, swelling, and pain of the eyes, trigeminal neuralgia, deviation of the eyes and mouth. Puncture 0.3 to 0.5 Cun, or prick to cause bleeding with a 3-edged needle. Jinjin, extra point. In the mouth, on the vein on the left side of the frenulum of the tongue. Indications: diabetes, ulceration of the mouth, vomiting, diarrhea, and aphasia with stiffness of the tongue. Prick to cause bleeding. Yu Ye, extra point. On the vein on the right side of the frenulum of the tongue. Indications: aphasia with stiffness of the tongue, vomiting, diarrhea, diabetes, and ulceration of the mouth. Prick to cause bleeding. Dingchuan, extra point. On the back, 0.5 Cun lateral and below the spinous process of the 7th vertical vertebra. Indications: asthma and cough. Puncture 0.5 to 1 Cun with the tip of the needle obliquely towards the spinal column. Jiaji, extra point. A group of 34 points on both sides of the spinal column, 0.5 Cun lateral to the lower border of each spinous process from the thoracic vertebra to the 5th lumbar vertebra. Indications: cough, asthma, pain in the chest and hypochondriac region, and intercostal neuralgia. Puncture 0.3 to 0.5 Cun, apply 3 to 5 moxicons, or 10 to 30 minutes moxibustion. Yao Tong Dian, extra point. On the dorsum of the hand, midway between the 2nd and 3rd metacarpal bones, and between the 4th and 5th metacarpal bones. There are 4 points in all, on both sides. Indications: lumbago due to acute lumbar sprain. Puncture 0.3 to 0.5 Cun. Wai Lao Gong, extra point. On the dorsum of the hand, between the 2nd and 3rd metacarpal bones, 0.5 Cun posterior to the metacarpal phalangeal joint. Indications: pain in the chest and hypochondriac region, swelling and pain of the dorsum of the hand. Puncture 0.3 to 0.5 Cun, apply 3 to 5 moxicones, or 10 to 20 minutes moxibustion. Feng, extra point. On the palmar surface, at the midpoint of the transverse creases of the proximal interphalangeal joints of the index, middle, ring, and little fingers. Indications: malnutrition and indigestion. Prick 0.1 Cun and squeeze out a small quantity of yellow and white transparent fluid or blood. Xuxian, extra point. On the tips of the 10 fingers, about 0.1 Cun distal to the nail. They are commonly used for emergency treatment. Indications: apoplexy, coma, syncope, shock, sunstroke, high fever, infantile convulsion, hysteria, and epilepsy. Puncture quickly 0.1 Cun or prick to cause bleeding with 3-edged needles. Xiyan, extra point. A pair of points on the 2 depressions medial and lateral to the patellar ligament. Locate the points with the knee flexed. These 2 points are also termed medial and lateral xiyan, respectively. Indications: swelling and pain of the knees and sprain. Puncture 0.5 to 0.8 Cun, apply 3 to 5 moxicones, or 10 to 20 minutes moxibustion. Danang, extra point. On the lateral side and upper part of the leg, in the depression anterior inferior to the head of fibula, directly 2 Cun below Yanglingquan, gallbladder 34. Indications: biliary infection and ascariasis. Puncture 0.5 to 1 Cun. Lanwei, extra point. On the lateral side and lower part of the leg, 5 Cun below Dubi, stomach 35, and 1 finger breadth to the anterior border of the tibia. Indications: acute appendicitis. Puncture 1 to 1.5 Cun, apply 3 to 5 moxicones, or 10 to 30 minutes moxibustion. General review. Points of the head and neck. Bai Hui, do 20. On the head, 5 Cun directly above the midpoint of the anterior hairline. Shangxing, do 23. On the head, 1 Cun directly above the midpoint of the anterior hairline. Towei, stomach 8. On the lateral side of the head, 0.5 Cun above the anterior hairline at the corner of the forehead. Yintang, extra point. On the forehead at the midpoint between the bilateral eyebrows. Shuigou, do 26. On the face at the junction of the upper third and middle third of the philtrum. Changjiang, rem 24. On the face in the depression at the midpoint of the mentolabial sulcus. Yinxiang, large intestine 20. In the nasolabial groove beside the midpoint of the lateral border of nasal ala. Dicang, stomach 4. On the face directly below the pupil beside the mouth angle. Jinjin, extra point. In the mouth on the vein at the left side of the frenulum of the tongue. Yuye, extra point. In the mouth on the vein at the right side of the frenulum of the tongue. Points in the eye area. Chuanzhu, bladder 2. On the face in the depression of the medial end of the eyebrow at the supraorbital notch. Jingming, bladder 1. On the face in the depression slightly above the inner canthus. Yangbai, gallbladder 14. On the forehead, directly above the pupil, 1 Cun above the eyebrow. Chengqi, stomach 1. On the face, directly below the pupil, between the eyeball and the infraorbital ridge. Sibai, stomach 2. On the face, directly below the pupil, in the depression of the infraorbital foramen. Qiuhou, extra point. On the face, at the junction of the lateral fourth and medial 3/4 of the infraorbital margin. Sizhukong, Sanjiao 23. On the face, in the depression of the lateral end of the eyebrow. Tongziliao, gallbladder 1. On the face, lateral to the outer canthus, on the lateral border of the orbit. Taiyang, extra point. At the temporal part of the head, between the lateral end of the eyebrow and outer canthus. Points in the cheek area. Xiaguan, stomach 7. On the face, anterior to the ear, in the depression between the zygomatic arch and mandibular notch. Jiache, stomach 6. On the cheek, 1 finger breadth, anterior and superior to the mandibular angle. Armen, Sanjiao 21. On the face, in the depression behind the posterior border of the condyloid process of the mandible. Qinggong, small intestine 19. On the face, anterior to the tragus and posterior to the mandibular condyloid process. Jinghui, gallbladder 2. On the face, anterior to the intratragic notch. Yifeng, Sanjiao 17. Posterior to the earlobe, in the depression between the mastoid process and mandibular angle. Points in the neck area. Lianquan, Ren 23. On the neck, in the depression above the upper border of the hyoid bone. Tiantu, Ren 22. On the neck and on the anterior midline, at the center of the suprasternal fossa. Futu, large intestine 18. On the lateral side of the neck, besides the laryngeal protuberance, between the anterior and posterior borders of sternocleidomastoid muscle. Fangfu, Du 16. On the nape, 1 cun directly above the midpoint of the posterior hairline. Fangshi, gallbladder 20. On the nape, in the depression between the upper ends of sternocleidomastoid and trapezius muscles. Tianzhu, bladder 10. On the nape, in the depression of the lateral border of the trapezius muscle. Points of the chest and abdomen. Points in the chest regions. Zhongfu, long 1. In the superior lateral part of the anterior thoracic wall, 1 cun below Yunmen, long 2, on the level of the first intercostal space, 6 cun lateral to the anterior midline. Danzhong, Ren 17. On the chest and on the anterior midline, on the level of the 4th intercostal space. Rugen, stomach 18. On the chest, directly below the nipple, on the lower border of the breast, in the 5th intercostal space. Ximen, liver 14. On the chest, directly below the nipple, in the 6th intercostal space, 4 cun lateral to the anterior midline. Juque, Ren 14. On the upper abdomen and on the anterior midline, 6 cun above the center of the umbilicus. Zhongwan, Ren 12. On the upper abdomen and on the anterior midline, 4 cun above the center of the umbilicus. Shenque, Ren 8. On the middle abdomen and at the center of the umbilicus. Qihai, Ren 6. On the lower abdomen and on the anterior midline, 1.5 cun below the center of the umbilicus. Guanyuan, Ren 4. On the lower abdomen and on the anterior midline, 3 cun below the center of the umbilicus. Zhongji, Ren 3. On the lower abdomen and on the anterior midline, 4 cun below the center of the umbilicus. Liangmen, stomach 21. On the upper abdomen, 4 cun above the center of the umbilicus and 2 cun lateral to the anterior midline. Tianshu, stomach 25. On the middle abdomen, 2 twin lateral to the center of the umbilicus. Guilai, stomach 29. On the lower abdomen, 4 twin below the center of the umbilicus and 2 twin lateral to the anterior midline. Riye, gallbladder 24. On the upper abdomen, directly below the nipple, 4 twin lateral to the anterior midline. Zhangmen, liver 13. On the lateral side of the abdomen, below the free end of the 11th rib. Points on the back. Dazui, Ju 14. On the posterior midline in the depression below the 7th cervical vertebrae. Zhiyang, Ju 9. On the back and on the posterior midline in the depression below the spinous process of the 7th thoracic vertebrae. Mingmen, Ju 4. On the low back end of the posterior midline in the depression below the spinous process of the 2nd lumbar vertebrae. Yaoyang Guan, Ju 3. On the low back end of the posterior midline in the depression below the spinous process of the 4th lumbar vertebrae. Changqiang, Ju 1. Below the tip of coccyx, at the midpoint of the line connecting the tip of coccyx and the anus. Dazhu, bladder 11. On the back, below the spinous process of the 1st thoracic vertebrae. Fengmen, bladder 12. On the back, below the spinous process of the 2nd thoracic vertebrae. Feishu, bladder 13. On the back, below the spinous process of the 3rd thoracic vertebrae. Jueyinshu, bladder 14. On the back, below the spinous process of the 4th thoracic vertebrae. Xinshu, bladder 15. On the back, below the spinous process of the 5th thoracic vertebrae. Geshu, bladder 17. On the back, below the spinous process of the 7th thoracic vertebrae. 1.5 twin lateral to the posterior midline. Ganshu, bladder 18. On the back, below the spinous process of the 8th thoracic vertebrae. Danshu, bladder 19. On the back, below the spinous process of the 10th thoracic vertebrae. Hishu, bladder 20. On the back, below the spinous process of the 11th thoracic vertebrae. Weishu, bladder 21. On the back, below the spinous process of the 12th thoracic vertebrae. Shenshu, bladder 23. On the lower back, below the spinous process of the 2nd lumbar vertebrae, 1.5 twin lateral to the posterior midline. Dachangshu, bladder 25. On the lower back, below the spinous process of the 4th lumbar vertebrae. Siliao, bladder 32. On the sacrum, just at the 2nd posterior sacral foramen. Fufen, bladder 41. On the back, below the spinous process of the 2nd thoracic vertebrae. Gao Huang, bladder 43. On the back, below the spinous process of the 4th thoracic vertebrae, 3 twin lateral to the posterior midline. Zhishi, bladder 52. On the back, below the spinous process of the 2nd lumbar vertebrae, 3 twin lateral to the posterior midline. Zhibian, bladder 54. On the buttocks and on the level of the 4th posterior sacral foramen, 3 twin lateral to the median sacral crest. Tianzong, small intestine 11. On the scapula, in the depression of the center of the subscapular fossa. Jianliao, Sanzhou 14. On the shoulder, in the depression inferior and posterior to the acromion when the arm is abducted. Jingchuan, extra point. On the back, below the spinous process of the 7th cervical vertebrae, 0.5 twin lateral to the posterior midline. Jiaji, extra point. On the back and lower back, below the spinous processes from the first thoracic to fifth lumbar vertebrae. Points of the upper extremities. Chizhe, lung 5. In the cubital crease, in the depression of the radial side of the tendons of the biceps muscles of the arm. Tongcui, lung 6. On the radial side of the palmar surface of the forearm, 7 cun above the cubital crease. Lieque, lung 7. On the radial side of the forearm, proximal to the styloid process of the radius. Taiyuan, lung 9. At the radial end of the crease of the wrist, where the pulsation of the radial artery is palpable. Yuji, lung 10. In the depression proximal to the first metacarpophalangeal joint. Shaoshang, lung 11. On the radial side of the distal segment of the thumb, 0.1 cun from the corner of the nail. Shaohai, heart 3. With the elbow flexed at the midpoint of the line connecting the medial end of the cubital crease and the medial epicondyle of humerus. Tongli, heart 5. On the palmar side of the forearm and on the radial side of the tendon of the ulnar flexor muscle of the wrist. Shenmen, heart 7. On the wrist, at the ulnar end of the crease of the wrist, in the depression of the radial side of the tendon of the ulnar flexor muscle of the wrist. Shaochong, heart 9. On the radial side of the distal segment of the little finger, 0.1 cun from the corner of the nail. Quzi, pericardium 3. At the midpoint of the cubital crease, on the ulnar side of the tendon of the biceps muscle of the arm. Ximen, pericardium 4. On the palmar side of the forearm, 5 cun above the crease of the wrist. Jianshi, pericardium 5. On the palmar side of the forearm, 3 cun above the crease of the wrist. Neiguan, pericardium 6. On the palmar side of the forearm, 2 cun above the crease of the wrist. Daling, pericardium 7. At the midpoint of the crease of the wrist, between the tendons of the long palmar muscle and the radial flexor muscle of the wrist. Zhongchong, pericardium 9. At the center of the tip of the middle finger. Sifeng, extra points. 4 points on each hand, on the palmar side of the second to fifth fingers, and at the center of the proximal interphalangeal joints. Xuxuan, extra points. 10 points on both hands, at the tips of the 10 fingers, 0.1 cun from the free margin of the nails. Jianyu, large intestine 15. On the shoulder, superior to the deltoid muscle, in the depression anterior and inferior to the acromion, when the arm is abducted or raised on the level of the shoulder. Quchi, large intestine 11. With the elbow flexed, at the lateral end of the cubital crease, at the midpoint of the line connecting Chizhe, lung 5, and the external humeral epicondyle. Pianli, large intestine 6. With the elbow slightly flexed on the radial side of the dorsal surface of the forearm. Yangxi, large intestine 5. At the radial end of the crease of the wrist. Hegu, large intestine 4. On the dorsum of the hand, between the first and second metacarpal bones. Shangyang, large intestine 1. On the radial side of the distal segment of the index finger, 0.1 cun from the corner of the nail. Xiaohai, small intestine 8. On the medial side of the elbow, in the depression between the olecranon of the ulna and the medial epicondyle of the humerus. Zhizheng, small intestine 7. On the ulnar side of the posterior surface of the forearm, 5 cun proximal to the dorsal crease of the wrist. Yanggu, small intestine 5. On the ulnar border of the wrist, in the depression between the styloid process of the ulna and the triangular bone. Wangu, small intestine 4. On the ulnar border of the hand, in the depression between the proximal end of the 5th metacarpal bone and hamate bone. Houxi, small intestine 3. At the junction of the red and white skin along the ulnar border of the hand, at the ulnar end of the distal palmar crease. Shaozi, small intestine 1. On the ulnar side of the distal segment of the little finger, 0.1 cun from the corner of the nail. Zhigou, sanjiao 6. On the dorsal side of the forearm, 3 cun proximal to the dorsal crease of the wrist. Waiguan, sanjiao 5. On the dorsal side of the forearm, 2 cun proximal to the dorsal crease of the wrist between the radius and the ulna. Yangchi, sanjiao 4. At the midpoint of the dorsal crease of the wrist. Zhongzhu, sanjiao 3. On the dorsum of the hand, proximal to the 4th metacarpophalangeal joint, in the depression between the 4th and 5th metacarpal bones. Yao Tongdian, extra point. 2 points on the dorsum of each hand, between the 1st and 2nd, and between the 3rd and 4th metacarpal bones. Wai Lao Gong, extra point. On the dorsum of the hand, between the 2nd and 3rd metacarpal bones. Points of the lower extremities. Biguan, stomach 31. On the anterior side of the thigh, on the level of perineum when the thigh is flexed, the depression lateral to the sartorius muscle. Dubi, stomach 35. With the knee flexed on the knee, in the depression lateral to the patella and its ligament. Zusanli, stomach 36. On the anterior-lateral side of the leg, 3 cun below Dubi, stomach 35. Shangju Xu, stomach 37. On the anterior-lateral side of the leg, 6 cun below Dubi, stomach 35. Tiaoko, stomach 38. On the anterior-lateral side of the leg, 8 cun below Dubi, stomach 35. Fanlong, stomach 40. On the anterior-lateral side of the leg, 8 cun above the tip of the external malleolus. Chongyang, stomach 42. On the dome of the instep of the foot, where the pulsation of the dorsal artery of the foot is palpable. Neiting, stomach 44. At the junction of the red and white skin, proximal to the margin of the web between the 2nd and 3rd toes. Li Dui, stomach 45. On the lateral side of the distal segment of the 2nd toe, 0.1 cun from the corner of the toenail. Wei Zheng, bladder 40. At the midpoint of the popliteal crease, between the tendons of the biceps muscle of the thigh and the semitendinous muscle. Changshan, bladder 57. On the posterior midline of the leg. Feiyang, bladder 58. On the posterior side of the leg, 7 cun directly above Kunlun, bladder 60, and 1 cun lateral and inferior to Changshan, bladder 57. Kunlun, bladder 60. Posterior to the lateral malleolus, in the depression between the tip of the external malleolus and the Achilles tendon. Renmai, bladder 62. On the lateral side of the foot, in the depression directly below the external malleolus. Zhiyin, bladder 67. On the lateral side of the distal segment of the little toe, 0.1 cun from the corner of the toenail. Huantiao, gallbladder 30. On the lateral side of the thigh. Fangshi, gallbladder 31. On the lateral midline of the thigh. Yangling-quan, gallbladder 34. On the lateral side of the leg, in the depression anterior and inferior to the head of the fibula. Guangming, gallbladder 37. On the lateral side of the leg, 5 twin above the tip of the external malleolus on the anterior border of the fibula. Xuanzhong, gallbladder 39. On the lateral side of the leg, 3 twin above the tip of the external malleolus on the anterior border of the fibula. Qiuxu, gallbladder 40. Anterior and inferior to the external malleolus. Zulingqi, gallbladder 41. On the lateral side of the instep of the foot, posterior to the 4th metatarsophalangeal joint. Xiaxi, gallbladder 43. On the lateral side of the instep of the foot, between the 4th and 5th toes. Xiyan, extra point. In the depressions on both sides of the patellar ligament when the knee is flexed. Danang, extra point. At the upper part of the lateral surface of the leg, 2 twin directly below Yangling-quan, gallbladder 34. Lanwei, extra point. At the upper part of the anterior surface of the leg, 5 twin below Dubi, stomach 35, and 1 finger breadth lateral to the anterior crest of the tibia. Xuehai, spleen 10. With the knee flexed on the medial side of the thigh, 2 twin above the superior medial corner of the patella. Yinling-quan, spleen 9. On the medial side of the leg, in the depression posterior and inferior to the medial condyle of the tibia. Diji, spleen 8. On the medial side of the leg, 3 twin below Yinling-quan, spleen 9. Saninjiao, spleen 6. On the medial side of the leg, 3 twin above the tip of the medial malleolus, posterior to the medial border of the tibia. Gongsuan, spleen 4. On the medial border of the foot, anterior and inferior to the proximal end of the 1st metatarsal bone. Taibai, spleen 3. On the medial border of the foot, in the depression of the junction of the red and white skin. Yinbai, spleen 1. On the medial side of the distal segment of the great toe, 0.1 twin from the corner of the toenail. Yingu, kidney 10. On the medial side of the popliteal fossa, between the tendons of semitendinous and semimembranous muscles when the knee is flexed. Fuliu, kidney 7. On the medial side of the leg, 2 twin directly above Taixi, kidney 3, and anterior to the Achilles tendon. Zhaohai, kidney 6. On the medial side of the foot, in the depression below the tip of the medial malleolus. Taixi, kidney 3. On the medial side of the foot, posterior to the medial malleolus. Rangu, kidney 2. On the medial border of the foot, below the tuberosity of the navicular bone, and at the junction of the red and white skin. Yongquan, kidney 1. On the sole, in the depression appearing on the anterior part of the sole when the foot is in plantal flexation. Ququan, liver 8. On the medial side of the knee, at the medial end of the popliteal crease when the knee is flexed. Ligou, liver 5. On the medial side of the leg, 5 twin above the tip of the medial malleolus, on the midline of the medial surface of the tibia. Taichung, liver 3. On the instep of the foot, in the depression of the posterior end of the 1st interosseous metatarsal space. Xingjian, liver 2. On the instep of the foot, between the 1st and 2nd toes. Daduan, liver 1. On the lateral side of the distal segment of the great toe, 0.1 twin from the corner of the toenail.
一路漫漫，披迹相伴。